We will be getting started in about 2 minutes. All right, let's get started. If you haven't done so already, make sure under audio options that you have listen only selected, or if you're dialed in that you've muted your phone. Today's presentation, this webinar, Squeeze Every Penny Out of Your Health Insurance, is presented by the Hereditary Colon Cancer Foundation and sponsored in part by Myriad Genetics and Genentech. I am your host and moderator, Travis Bray. Just to kind of connect me, I have FAP, and founded this foundation with my wife, Shawnee, and the current president. Just a little bit about the foundation itself. We're serving the community, the hereditary colon cancer community, by connecting patients and caregivers and medical professionals to the educational, social, and financial resources that are out there, or resources that we're developing. And then we're also promoting research and healthcare initiatives. This webinar is a part of a series of webinars that we intend to do over the next year. There's a few of the topics here: advocating for specialized care, how to prevent colon cancer. One of the exciting ones for me is the nutritional considerations for people with intestinal diversions. This is a big project that we're working on. Then we'll be discussing intestinal diversions, what the options, procedures are, the patient experiences, and then we'll be working on putting together a case study. We are a Gold Star or Guide Star Gold-rated participant as a credit to our transparency. Today's webinar will be presented by Michelle Sutter. She is a patient advocate with attenuated familial adenomatous polyposis, and she is the president of Health and Benefit Operations at World Insurance Association Incorporated. A little logistics for the webinar as we go through. On the left, you'll see a vertical oval where participants can chat through the course of the presentation. Above that, for whatever reason it's not shown, is the where you would toggle your audio options to listen only. The circle on the top left, if you have questions for Michelle as we go through the presentation, that's where you'll enter your questions, and then we'll go through those towards the end, or at the end. At the very bottom is a way that you can provide active real-time feedback for us by changing the little ball left and right from cold to this doesn't really, meaning this doesn't apply to me, or hot, meaning I really like what I hear. And then At the end of the presentation, we've been working with Michelle on a really cool prescription discount card, and we'll be giving you some more information on that and telling you how you can get your own prescription card. So if you'll just give me a couple of minutes, I need to switch the presentation over to Michelle, and then she'll be getting started. Michelle, I'll send it to you. Just there you go. Perfect.
Thank you for the introduction, Travis. As Travis said, I'm Michelle Sutter and serve as President of World Insurance Health and Benefit Operations. I've worked in the insurance industry now since 1987. I was first licensed, so some 25 plus years that I've been working in all realms of insurance, but most specifically the health insurance side for the last 15 years. So our goal today is to talk about squeezing every penny out of your health insurance. As the graphic shows on the right-hand side, unfortunately, none of us have found the money that has a tree or money that grows on trees. So my goal at the end of this presentation is to give you tips on how to have a little bit more money in your pocket, how to understand your options, how to navigate through the healthcare system, especially with all the new changes in the last couple of years. So I'm going to get started. If you have a pencil, I'll be giving you lots of notes, but you can also, after the presentation, get a copy of my PowerPoint, as many of them will give you things that you can use on an ongoing basis. So to give you a little bit background on my story, I've been married to my husband for 18 years, and both of us are blessed to have 4 wonderful children. 2 of them are stepchildren, 2 of them are biological. I normally don't mention that. I just say we have 4 children, but when we talk about genetic diseases, if someone asks me how many of my children also have FAP, and I said 1, they might ask me, oh, you beat the odds. The 50-50 does apply in my case with 2 biological children. We did find out last year, a year and a half ago, that my daughter, who is 17, also has the same condition. So I'm currently 45. I was diagnosed with attenuated FAP in the spring of 2012. Attenuated because mine was a late in life occurrence versus finding out and having growth in my teenage years. I was the first one in my family to be genetically tested. Never had heard of it before and was actually quite surprised when I diagnosed. From the time of diagnosis and going through genetic counseling to surgery, it was just over 90 days. So I had my surgery in July of 2012. So here I sit 2 years later. Life has changed, but life is, we just take what it gives us and do very well and do my best to work very hard every day and take my background and become a champion of the cause. The hardest day of my life, I have to say, wasn't my diagnosis. It was actually my daughter's. As a mom, that's something you never want to pass on to your children. I definitely wanted to give them my bubbly personality and my hard work ethic, not a genetic condition. But now in my moving forward, I'm not just fighting for a cure for myself, but more so for my daughter, who is faced with many things moving forward on a preferred basis and trying to find new research programs, registries, anything that we can do to learn more versus just Googling it. And that's been a great piece. And how I teamed with Travis and Shawnee was by them working to be patient advocates and bringing more information out of knowing what I went through when I was first diagnosed and had to Google it to even know what it was. And if any of you have done that, it's not the best information you receive when you Google it because it makes it sound like it's a death sentence, which it doesn't have to be, but it's scary when you're faced with that alone. And Travis actually gets the designation of being the first person that I actually ever met in person that also had FAP other than myself and my daughter. As you all know, it's rare and you don't come across people in your everyday life that know what it is or can understand what it is. In 2013, I made my decision to move all my care to the Cleveland Clinic because, as you see on the slide, in 2 years I had 3 different insurance companies due to my husband's job change, which were all different plans and all different networks. And I was really struggling to find a specialist here, and I live in the Atlanta area, And it was a challenge, and I was having to go to different facilities and different doctors and trying to manage my medical records and trying to manage all the changes and credits for deductibles and coinsurance. So I finally decided that after much research that for me and my daughter it made more sense that now once a year we fly to Cleveland, which for us made more sense versus I would spend almost as much driving around to all the different facilities here in Atlanta and different copays and different visits. And now it's very nice to have everything that we need and all of our annual tests scheduled for us, and we can go for 2 or 3 days and be done with it. So again, as I said, my new mantra in life is champion the cause, and that's one of the reasons that I'm doing today's presentation is to take my background and knowledge and the understanding of what it is like to have a genetic condition such as FAP and turning that into looking into what we all deal with on it every day is our healthcare cost. So we're going to go over 10 things that you need to know. Actually, if I counted it up, there's many more points than 10, but I wanted to keep to 10 categories. So today we'll talk about how to obtain coverage and where, what plan to select, and some terms to know that you'll hear in the industry that are different over the last few years, network access and what you need to know about centers of excellence, differences between and should you select an HMO versus a POS versus a PPO, what's actually covered and how the rules work relative to ACA preventive care laws, understanding your deductibles, copays, coinsurance, and more, understanding your explanation of benefits, and then tips on how to save on pharmacy costs, lab and imaging costs, and other ways to save. The biggest thing I'll say, and the goal for today's presentation, is you really need to become your own advocate. And what I mean by that is you need to learn to ask questions and arm yourself with knowledge. I work with employees and individuals, employers, companies nationally. We're certified as a company to offer health insurance in all 50 states and internationally. So I've seen the gamut from when it comes to claim issues and costs and misunderstandings and how plan designs work. I've done this for many years. I work with thousands of employees and individuals. The biggest thing is teaching them, and this same type of presentation is what I take to companies on a national basis, is I'll have employees come up to me and say, I don't like my health insurance. Many times it's because they don't understand it. So when they get a bill in the mail, which they don't understand why they're getting it, then therefore they automatically don't like it. So my goal is to give you the tools, to give you the tips, to arm yourself with the knowledge so that you can purchase the best plan or select the best plan, whether it's at the employer level or buying it individually, so that you understand from the get-go of what your potential cost and exposure is. Terms to know. These are new. If I gave this presentation 2 or 3 years ago, I wouldn't have been discussing these terms, but I bring them up now because you're going to see it on the news. You're going to see it in the newspapers, in the Wall Street Journal, in the USA Today, in your local publications. The first one you're going to hear a lot about is Obamacare. That simply means that the new laws that were put into 2010 have just been tagged it. So Obamacare can be a huge umbrella of many, many terms. It's just something that was coined since 2010 when this all started taking place. ACA, you'll hear a lot of that, and that stands for Affordable Care Act. The other thing you'll hear a lot is exchange or marketplace. Really, that just stands for healthcare.gov. They're all one and the same. When they first rolled it out, they were calling it the exchange, which they found confused people, so then they changed their marketing to say marketplace. So if you hear that, they all really are one and the same. HCR stands for healthcare reform. You'll hear the term navigator versus a certified agent. So for example, I'm a certified agent. In my company, we have a host of certified agents that we're qualified to sell healthcare reform plans, Obamacare, however you want to, the marketplace, the exchange, they all come under the same umbrella, and we can offer those to any of our clients and even those of you on the phone that need assistance. A navigator is different. A navigator is there to answer your questions. If you were to call to your state exchange and they put you in touch with a navigator, in most cases they're not insurance licensed, but they've been trained to answer your basic questions on how the plans work, how to apply, things of that nature. But if you truly want someone who has their insurance license, who has experience at picking plans, because there is many, many options, then I would suggest you work with a certified agent, only because they have their license and they've seen years of plans being rolled out, and they understand them, that if you really need to get into specific questions relative to the coverage, the agent side would help you. The navigator is more to help navigate on how to enroll. Age-banded rates. This is something new with applying through healthcare.gov. Every age from age 21 to 64 has a different rate per plan. Before, in the past, when you paid a rate, typically it would change every 5th year. That's been modified, and as of 2014, you will see age-banded rates. In the past, you also got a different rate for male-female. That is no longer the case. That has gone away, and now everybody pays the same rate, and it's based on your age. Subsidy. This is when you apply to healthcare.gov, and based on your income, and it varies per person across the board, so everyone is different, is you answer a series of questions based on your income, and then they'll come back and tell you, based on their calculation, how much a plan would be. The one term I didn't put on here that I should have is bronze, silver, and gold. That's how they've labeled their plans in platinum. So then you look at them and say, if you want a bronze plan, this is how much your subsidy and this is how much your cost is per month. So that's where the subsidy comes in, but you have to qualify for it, and it's based on your income. Essential health benefits. This came into play because these are required on individual and small group plans, and I'll go over that in the presentation. Pay or play. This was a big one 3 years ago. It actually was a mandate to employers that employers have to offer health care coverage if they have more than 50 employees. It was delayed till 2015, but as of today, it is still in play and it will start as of January 1st. Please note that anything I discuss about the exchange is effective through today. As far as healthcare reform, Affordable Care Act, they still have some things under discussion and are subject to change. For the most part, what I discussed today, I don't believe will change, but in theory it could. There also is an affordability clause, and this is at the employer level, to ensure that when they offer a plan that it is affordable, and there are guidelines that they have to go by. So I work as a consultant and I work with companies to do this calculation to make sure that they're offering the correct plans and that they're affordable. If they don't comply with the affordability clause, then there are penalties tied to it, the same that there would be with pay or play. They just vary in the amount. The biggest ones for those on the call are guaranteed issue and no pre-ex. If we go back a year ago and you applied for health insurance, and if any of us, even if I did, and this is on an individual level, not at a group level. Groups have always had guaranteed issue, some with pre-ex, but for the most, if you went into a group at your employer level, you were guaranteed coverage, there would be a cost, but you could get coverage. That was the advantage of being employed so that you would have access to care. The challenge that came in over the years is that if you weren't employed and you didn't have access to a group plan, what do I do if I have a health condition? Because sadly, you could have been declined. Up until this year, that now has changed, which is very nice because that gives everyone access to care. There's no pre-ex, there's no medical questions. I mean, it varies from size of employer to individuals as far as how you get that access, but there's no pre-existing, there's no questions to be asked, and it's a very nice feature and one of the biggest features that came out of the new Affordable Care Act. The next question is, how do you obtain coverage? There's more options than ever now. Your first would be through your employer or your spouse's employer. This is group-based coverage at a shared cost. So your employer, based on the law of large numbers and purchasing a group plan because they have a group of employees, is they can go to the market, purchase a plan, go through the carriers. There's different level of carriers and it varies by state. And then they turn around and offer that plan to their employees and they pay a portion, typically of the employee-only cost. Some will fund towards having dependents covered, but most focus on the employee, and even some now have gone to excluding spouses and making spouses go get coverage on their own because they are allowed to do that Two of the biggest employers that started that and published it last year was Delta and UPS. The reason they did this is to help to control their costs. And before, they could have never done that because a spouse could have been sick and could have been denied coverage, and they would have never done that to the employees. Well, now with the marketplace, the exchange, healthcare.gov, guaranteeing coverage to everyone, now they feel they can do that to help save costs, and then that spouse would either go on their employer's plan or look at the alternative places that they can get coverage. Another option that's still out there is COBRA. This varies by state. It varies by size of employer. Some call it state continuation for small employers, but COBRA is still alive and well out there, and then you can look at your options if it makes sense. For those who are up to age 26, you can get coverage through your parents' plan. There are certain rules that apply, but for the most part, even if you're married, even if you have children and you do not have access to care, you can be on your parents' plan up to age 26. Then you have the individual exchange/marketplace, healthcare.gov that I talked about. The next open enrollment is in October. So if you didn't take advantage of the open enrollment last year, you're not out. You still have that ability to do that. You just do it during open enrollment. This is where you can gain access to the individual subsidy. Now, there are some special circumstances where if you missed out on doing the open enrollment, that they will allow you to apply now. And if you think you're in one of the situations, just contact me directly. I can give you the list of special circumstances, and we can definitely see if we can help you. If by chance you're on the phone and you're a small business owner, they have opened the small business exchange across the country. There's small business tax credits that could exist. They do make you go through an approval process in order to have access to these plans, and we have those applications if that's something you want to look into. And believe it or not, a lot of people don't realize this. You can still buy carrier coverage directly. You're not required to go through healthcare.gov. It just is one of the many options where you can gain access to coverage. But you are not required to, and if you wanted to, you can still apply for coverage direct to the carrier. Many of them still have the open enrollment rules like the marketplace, but if you don't want to go through or you know you're not going to qualify for a subsidy, so you don't want to jump through those extra hoops, you do have that as an option. There's also short-term medical options, and these are bridge coverage. We've done this with quite a few individuals who missed the open enrollment and didn't have one of those special circumstances, but they wanted to make sure they had something in the event of a catastrophic illness. So then what they did is they purchased a short-term medical plan to get them through till October 1st. And as always, there's still Medicare and MedSup options for 65 plus. And then throughout the country, there's Medicaid and CHIP programs. Now this is a little confusing because Medicaid did not expand in every state. So this is by state, so you have to be aware of that if you don't qualify for the subsidy because your income's too low, it's not an automatic that you could get Medicaid. But again, that's a case-by-case basis, and that's what we help our clients through. So the goal of teaming with the Hereditary Colon Cancer Foundation and Travis and Shawnee was to help and to give you, the patient, the member, a way to find the best solution. So access to care is available to all, and then we're here to assist in answering questions and helping guide you to where you need to go. Probably one of the biggest twists that came out of this was network access. We're all very used to Blue Cross Blue Shield of whatever state, or Anthem, or WellPoint, United Healthcare, Aetna, Cigna, all of the carriers nationally, whether it's national carrier or regional carrier. In the past, most people thought, okay, they have one network. Do you take Blue Cross? You would ask your doctor, and they, oh, sure, we take Blue Cross. That has changed. With healthcare reform, the carriers have developed different networks to try and drive costs down. So you're going to see expansive networks. You're going to even have regional networks. You even have a new term out there called skinny networks. And one of probably the biggest challenge coming out of, next to the website not working for people to apply for healthcare.gov, is they didn't do the research on the networks. So when they went to apply for coverage, they assumed I bought a Blue Cross Blue Shield plan, and now I have a network of Blue Cross Blue Shield, and that's awesome. Unfortunately, there's different plans and different networks. So when I even get a group quote, say if I'm quoting a group with 200 employees, I'll now have access to over 500 different plans to pick from to recommend for my client. But it's not just plan changes. There's all different networks. So you really have to pay attention to that one. And that's the one that I find most who come to me after the fact that already applied for coverage have had the biggest challenge with. Because at the end of the day, when we look at healthcare and having a medical plan, it's great to have a low-cost plan. But if you don't have a network, you're not really doing yourself a great favor because you're going to end up paying more in the end because you would have to pay out of network. So that's the one that I really want you to take note of, is paying attention to. And then I put the term Center of Excellence. What that is all of your carriers nationally know that every town in America does not have the best treatment for every condition. So what they do is they'll go around and look at what are Mayo Clinic specialties, what are Cleveland Clinic, Huntsman, whoever it might be. Can we team with them so our patients, for example, I live in Atlanta. My plan actually is out of Wisconsin because that's the home office of my husband's company, and they team with the Cleveland Clinic. So I was able to get all of my care through the Cleveland Clinic in network. And it's because I asked the questions, I knew and did my homework, that now I couldn't get the best quality of care in my hometown because it's a rare condition, because I wasn't finding anybody that knew enough about it. Or if I had one more person Google it and say, oh, is this what you had? That wasn't the type of care I was looking for myself or my daughter. I wanted to go in and have a conversation with someone who I didn't have to beg for a test or explain to them why I need a thyroid scan. I want to know I was going to the best in breed, the best in the business, and in the end for me that was Cleveland Clinic. And why I say that is if you have a health carrier, call and ask them, who are your centers of excellence if I ever was diagnosed with cancer, and do it hypothetically and ask them. And very few do not have this set up because they understand the need to have that team where they can send those insured patients. The other thing you can ask for is a healthcare advocate. The first slide I told you my story that we have 4 children. Of the 4, we have my daughter who's 17 who has the same FAP. So she has a genetic cancer condition, if we want to call that. Well, the second oldest was diagnosed with testicular cancer 5 years ago. So I've gone through the gauntlet of knowing about costs, challenges of care. He lived in a different state. He was on his dad's plan. How do we get it approved? So I understand firsthand between my surgery, his care, and my daughter, our medical expenses have been well into the 6 figures. If I added it all up, it would be well into $200,000-$300,000. So not only do I speak from experience as a professional, I speak from experience as a mom, as I understand how hard it is. When he was diagnosed with cancer, at that time we had United Healthcare as our carrier, and they assigned us a healthcare advocate. So she would check in with us, make sure everything was going okay. Do we need a referral? Was his care okay where he was at? And they have that. So if you're at a level of acute care, versus just your preventive care, you're doing well and just taking care of what we all need to take care of when we're having our good days, or if you unfortunately are having those bad days where you're more in the doctor than not, ask for a healthcare advocate. Just even if you don't talk to them on a frequent basis, knowing that they're there when you hit a roadblock is very nice versus just calling a customer service number and hoping you receive a caring and compassion person on the other line that's going to direct you the right way. The final thing on networks. If your doctor isn't in the network, and I specifically had this happen with a company a few years ago, they were going to opt for a larger network, and it was going to cost his 3 employees in total, and him as a company, an extra $800 a month. So I asked him, who are you missing from the network that is causing such an issue? He's like, I'm missing my cardiologist. Okay, how often do you see him? Once a year, just to check and make sure everything's okay. All right, well, let's do the math. If you're going to pay $1,000 times 12, you're paying $12,000 to see doctor cardiologist once. why don't you offer to pay him cash because it would be a heck of a lot less expensive? And that's exactly what he did. We all have insurance. We're not required to use them. If there's a better way to finance that visit, then do it. You can negotiate a cash price. So say if you look at the whole network and everybody is in there but one doctor who you really like, sit and talk to them and say, okay, you're not in my network. I still really want to see you. How much will you charge me? The nice part with direct pay options is typically they'll discount it because they don't have to file a claim and they like to be paid up front and not have to wait for their money. So what type of plan do you pick from? This primarily has stayed the same other than adding that bronze, silver, gold, metal structure. So you have HMOs, point of service, and PPOs. HMO is a health maintenance organization. These were brought into play in the 1970s in an attempt to manage care. You have a primary care specialist that you work with. They have referrals. I had one here in Georgia actually when I had my surgery. For me, it worked out well because they had a building. Everybody was in the same building. I could go to floor 3 to see my doctor, down to floor 1 to do my lab, go to floor 2 to see my next doctor. So for me, it worked. The challenge I ran into is they didn't have anyone, a specialty surgeon or hospital that was directly in their network, so I had to wait a little bit for approvals to get referred out of the HMO, but it was paid for because they knew I needed it, but they didn't have it, so then they have to pay for it. Point of service is an HMO, but the difference is it gives you out-of-network coverage because on an HMO, as most of you would know, you get that network and that network only. You cannot go out-of-network, and if you do, it's 100% out of your pocket. Point of service is nice because if you need to go out of network, at least you have the option. But just know, in reality, the in-network coverage is a mirror of what an HMO is. The best network typically out there is your PPO network. It's also the most costly of networks. So that's where you want to do the homework. I talked about networks, is seeing, do you really need that PPO? Can you function under a point of service plan and have that out of network if you need it? So just look and see. Those are the different options. And that's what ties in the network and the doctors that can see you. So whatever plan you have, when you call the doctors, you need to say, I have a Blue Cross PPO of Georgia, or in Alabama and it's Blue Cross of Alabama, whatever it might be, because you can have one doctor who does not accept the HMO but does take the PPO and vice versa. So you definitely need to ask that, because if someone says to you, well, I'll file the claim for you, that doesn't mean they're in network. You need to confirm they're in network. So then we look at what type of plans. So you have deductible and copay plans. You have just deductible only plans where everything goes to deductible. You have plans that are called HDHP, which is shortened term for high deductible plans. And then you have an HSA qualified plan, and the health savings account probably are the largest growing medical plans in the country. They were introduced in 2003. And these plans, everything applies to deductible, but it has some tax saving mechanisms built into it where you can put money away and have pre-tax savings on it if you so choose to. But there's all different plans, and actually today there's more plans to choose from than ever. The carriers have gotten quite creative. As of January 1st, there is not one plan that is the same as it was in 2013. So for me, I actually feel like I'm relearning everything of, if you talked to me a year ago, I pretty much could quote every plan in the country and styles and designs. So this last 6 months has been a learning process for me even, because now they've really changed the type of plans that you have access to. One of the terms I gave you in that terms to know was essential health benefits. This is for individual and small group plans, and through the healthcare reform law, ACA, they have to include coverage for these. These 10 is what made most plans non-compliant. There are some carriers out there saying in letter form that your plan has no longer qualified and is not ACA compliant. I'm seeing it mostly at the group level, but occasionally on the individual level. And everyone calls me in a panic thinking their plan's been canceled. That's not the case. It's actually just telling you that at renewal, you'll get a brand new plan to include the essential health benefits, because your old plan is not compliant. So just make sure you read it, and if you have questions, that's where being your own advocate is. Ask questions, because that's probably one of the biggest letters that have found confusion and panic of people calling me. But the 10 essential health benefits include outpatient services. So this would be when you receive care at a hospital without being admitted, inpatient services when you would be admitted to a hospital, emergency services, prenatal, maternity, and newborn care. This was not a guarantee in the past on individual plans. Not all carriers even offered maternity, so this definitely has been a plus for many. Pediatric care, this has been enhanced to include some vision and dental benefits that were new. That was the biggest kicker in making most plans not compliant, is most did not have that pediatric care. Preventative and wellness services, which we'll go over a little bit more in depth on the next slide. Chronic disease management, mental health disorder counseling and care, substance abuse and abuse counseling and treatment, prescription drug coverage. Again, that was not a requirement in the past, and now they are required. And then lab tests and services. So the level of copays and costs for every service is different based on plan, but at a minimum, they at least have to offer access to this care in every single plan for individuals and small groups. Large groups a little bit different, but most on this call would be applicable under the individual and small group, and then therefore those all apply. So I get the biggest one for anyone with our condition is going to be preventive care, because everyone thinks of colonoscopy. So just know that the preventive care guidelines came into effect in 2010, so this one's been around for a few years. Most doctors are pretty familiar with what's covered under preventive care. If you want a list, I printed out one today off of healthcare.gov. There's a different list for adults versus women versus children, and it was 33 pages long. I'm not going to read through the 33 pages of covered items, but the biggest one for us is colonoscopy. This, and I took the exact verbiage from healthcare.gov, because it's not always a 100% guarantee that this one's going to be covered in full, because if you read it, it says screening for colorectal cancer is covered under the Affordable Care Act, ACA, the healthcare reform law passed in 2010. Depending on your insurance plan, you may be able to get screened at no cost to you. And this is where a lot of people get caught, because typically they're going to consider our condition to be a diagnostic colonoscopy, and that's where you see it applying to your deductible in many cases. But this is where you have to ask questions. And when you go in and making sure that, is this my preventive or is this going to be considered diagnostic? If they code it preventive, it will be covered in full. If they code it diagnostic, it's going to apply to your whatever copay would be assigned on your plan, or possibly deductible. So this is definitely one that you have to arm yourself with knowledge and knowing, because I've had many people get a bill and they were surprised because they're like, oh, I thought that was preventive. Why isn't it covered? Carriers are trying to work around this and have enacted some new policies and procedures where even if they found one polyp, they wouldn't charge it as a diagnostic, but you have to ask. If you get billed for it, call and say, can this be under my preventive? It was my once a year, once every 5 years, whatever schedule you're on, to make sure it's preventive. And on the women's side, the one thing that I will say there is you'll find that your preventive visits could end up being 3 in total, but they're still all covered. And the reason why is you can have one at your OBGYN, you can have one at your primary care who does your blood work, blood pressure, cholesterol, that type of preventive, and then the next one's your mammogram, all of which fall under the preventive care laws as being 100% covered. You just have 3 different visits. Even on my mammogram this year, I received a bill for $27. I knew, because I do this for a living, that I shouldn't be paying anything. I called, oh, sorry, Mrs. Sutter, that was a mistake. So you have to pay attention, and we'll go over your explanation of benefits and managing your costs a little bit later in the presentation. But if you want to see a complete list, I'd be more than happy to email it to you. We just don't have time today for me to read you 33 pages of coverage. The basic things for preventive are going to be mammogram, your colonoscopy, Pap smears for women, PSA tests for men, your blood work, your blood pressure, cholesterol. And you can Google any of those, or if you want a list, we can actually work with Shawnee and Travis to post it on the website. So cost breakdown. Something that I say almost on a weekly basis, probably ad nauseum to my staff, is you have to do the math. is I constantly am looking at people and sitting with clients and going, okay, are we spending the dollars the best way that we can? Because the first thing we need to look at is our insurance premium, because that's a fixed cost. Okay, so every month I pay this much, whether it's after the subsidy or after employer contribution, whatever that cost is, and know what the cost is and what the different plan options are. Because I'll sit down and oftentimes when a company offers 2 or 3 plans, people just pick the most expensive plan because they think it's the best one. That's not always the case. Pay for the care that you need, manage your money. I would much rather pay for coverage as I go versus paying too much in premium, and at the end of the year I was healthy and I paid all that extra money and they don't send it back to you. So example of care costs. So we have first premium, so that's your first cost, and then you have care. So your care costs come in, your copays for primary care, specialist, pharmacy, lab and imaging, hospital charges. Not all plans have a copay tied to those, but some do. Deductible. Medical only deductible, some have pharmacy deductibles. So again, it differs by plan. And this is where you have to read what they now call and are required to provide you your summary of benefit and coverage. That, and they have to be in the same font, same print, and give you very specific language exactly on how all of these apply. If you don't have that for your plan, then ask for one. Then you're going to have co-insurance plans, and this can vary. So you can see a 90-10 plan, 80-20 plan, 70-30. What that means is after your deductible has been met, the carrier is going to pay 80% and you pay 20%, or 70-30, whatever your particular plan has. The biggest change in benefit for anyone on the call that has a lot of medical expenses is the new out-of-pocket maximum rules that kick in 2014. These kick in at renewal, so if you're on a group plan, it might not have kicked in yet, but will at some point in 2014. And what this does is it now caps off your out-of-pocket exposure. In the past, let's use an example, say you had a $5,000 deductible plan, but you had tons of pharmacy and medications you were taking and you were spending $300 a month. All right, so I was admitted to hospital and surgery and I paid $5,000. But then I was taking all this medication and I spent $3,600 in medication. You would have just kept paying and paying and paying for the medication. You would have had a cap on your deductible because I know it's $5,000. Well, now what they've done is they've taken and put to the out-of-pocket max that all copays, all deductibles, all co-insurance now applies to deductible, or not deductible, to your out-of-pocket maximum. So that's really a nice feature, is that if you have high cost of medications, it will help you get to at least a ceiling. Some of the plans are less than this amount as far as out-of-pocket max because employers can pick to have a lesser one. But the worst case scenario in any plan out there is $6,350 for individuals and $12,700 for families. So those who had very high pharmacy costs in the past and it felt like this endless run of money out of your wallet, there is a little bit of hope. Hopefully none of you on the call will hit this max, but it is a nice feature that's been added in. And this is my biggest one. Pay attention. Read your bills. This is a quote exactly from the Medical Billing Associates of America. Roughly 8 out of 10 medical bills contains errors, and doctors' offices and labs aren't exempt from making mistakes. It's in your best interest to eyeball your paperwork before writing a check. Don't be afraid to call your doctor or hospital billing department to clarify a charge, and be persistent. If something doesn't look right, ask questions. I gave you the example earlier of my mammogram. I was charged $27 when I wasn't supposed to. I've run into it. There's 6 of us on our medical plan, constantly writing invoices, and they're not correct. Now, could I have written a check for $27 and said, okay, I'm not worried about it, it's only $27? Yes. But as a mother of 4 and very frugal as I am, I have far better ways to spend $27 than sending it to a provider who likely is not going to refund it to me. So really pay attention, especially if you've been hospitalized recently, and if you have the hospital saying, hello, ma'am, Mr. Smith, you have a deductible, you have to pay us. When time comes to submit that claim, if the anesthesiologist got in front of the hospital when that bill was processed, you actually might owe that deductible to someone else, and then you have to go fight to get a refund. You got to pay attention. You got to look at everything. And the next page shows an explanation of benefits. This is what they call an EOB. Do not pay any invoice you get in the mail until you compare it to your explanation of benefits. The reason why is it shows on here exactly what the patient amount is. Due from patient, line number 18. This should match whatever you pay. If it doesn't, then you call the carrier or call your insurance agent or call the provider and ask them, why does it say for this procedure I owe $15 but you charge me $30? Or it says 0 because maybe it was preventive and they charge $27 like in my case. You have to pay attention. This also applies to dental, vision, anything that you pay for health care. We're all very good at monitoring our bills. If I get my cable bill and it's wrong, I call the cable company and I ask them, why'd you bill me more? Or my cell phone bill. But for some reason on health care, I just don't see it happening. So this is one of my biggest points. If we're trying to squeeze every penny, make sure that you're managing the pennies and that you're paying the exact correct amount. And I've gone through it. Back to that 300,000 in claims I've dealt for 6 years, there has been countless errors that I've had to get corrected. And that's what you have to be an advocate in making sure that they're correct. So now let's go into some tips on how to save on money. One of the big ones is pharmacy costs. Studies show that 1 in 2 Americans are on some type of prescription. We see an average of 2 to 3. I laugh at night. If I sat home and watched TV from 6 to 9 p.m., I probably diagnosed myself with three different conditions by 9 o'clock with all the different advertising that goes on. My tips here, talk to your pharmacist. Your pharmacist is going to be the one that has studied and understands prescriptions the best. Your doctor's office typically will know the latest and greatest, the ones on TV, and they do have samples, but they don't necessarily know all the knowledge about all the different options from, generic to tier 1 to tier 2 to new tier 4 drugs. So if you're looking to save money, talk to the pharmacist and ask, is there a better way for me to pay for this? Is there a lower cost option? I just did it with my mom. For my dad, they were down here for the winter. He had to take a medication that was costing her $105 a month. And they're like, Mom, are you sure there isn't a better way to do this? So we went in and I talked to the pharmacist. He's like, oh, they didn't tell you? There's a $5 generic equivalent. And we asked what the difference was. Oh, it's a liquid instead of pill form and it's not the best tasting. Well, my parents are on a fixed income. For $100 a month, my dad could suck it up for 2 minutes or not even 2 seconds and drink it. And in the end, he didn't mind it. But it was $1,200 a year they saved because it was something he has to take ongoing. I had another patient that had the same thing, went to a plan that no longer had drug copays. So they saw for the first time the real true cost of what their prescription was cost. So they asked, was a generic equivalent? And in this case was told yes. And it was, the difference was there was a bit of aftertaste for 20 minutes and that was the only difference. But it was $160 less a month. So that's where you have to talk to your pharmacist, ask for generics. If you're at the doctor's and they want you to try for something new for the first time, ask for samples. They all have it. Use the new card that you have access through that we're providing to the Colon Cancer Foundation that can give you a discount on your prescription. Team with an RA consultant. This one we're not going to go into a lot of detail, but I do have a firm that will work with patients if you take more than 4 drugs in a month. They will work to manage that and work to get your costs down because they can buy in a volume. So that would be something you would contact us individually because that's an individual consultation. Shop around. You would be surprised that every drug is not the same price at every store. They buy in volume, they buy from different suppliers, so shop around because the cost of drugs, if you call 4 different pharmacies, you're going to get 4 different costs. National studies show that Costco is the best discounted pharmacy program out there because they buy in such volume. Visit a drug manufacturer's website. They might have rebates and ways to get costs down on the pharmacy side, or if you don't have coverage, some of them will help fund part of the cost. And you can also consider mail order. Mail order, what that does is if you're on a medical plan, typically you'll save half or 1 whole copay, and you can go to a 90-day supply. The other thing, and I just did this last week for myself, I live in a town where I have CVS on one corner, and then down the street I have Walgreens and I have Rite Aid. So I have 3 pharmacy options. Normally I go to Walgreens because it's convenient and it's right by my office, but I received a mailer in the mail from Rite Aid that said if I transferred a prescription, it would give me $25 up to 2. Well, my husband takes a cholesterol medication and I take another one, and if they're willing to give me $50 to drive across the street, I went and I took their $50. So there's a lot of different ways that you can save on it. Again, just doing your homework. If you're interested in one of the discount cards through the foundation, you can go to their website and it'll have the link. You can go through and do pharmacy locator. You can actually check on drug pricing, and there's a video that goes over how it works. It's not guaranteed to save you on everything, especially if you're going to Walmart for the $3 generics. And as a note, Walmart does offer over 300 $3 generics, and with that, just know, if you have an insurance card, you do not have to use your insurance card. If they offer it for $3, keep it in your pocket and pay the $3 because they are given the ability, if you have a $10 generic copay, they are allowed to keep the change. So back to I can spend my money better than them. If they were to keep the change of $7, that's $84 a year. I'm sure, again, you can all find a better way to do $84. So you can go to Walmart site or Walgreens, the different ones that have the $3 program. Here in Georgia, it's Kroger as well. And look at if they have your exact prescription for $3, do not hand them your insurance card. Pay $3 and be happy with that. Also on that discount card, it also includes discounts on pharmacy, dental care, lab savings, MRI and imaging, vision care, hearing. So again, using and being a good advocate, this card gives you access to DentaMax, which is a dental network. I actually tried it out, and through my dentist, who had never really been participating with networks, he was taking DentaMax, and it saved $300 on a crown. So this same pharmacy card that you order, on the back of it has all the information with regard to the vision discounts, dental discounts, and it also has a lab and imaging discounts. So when you shop around and asking questions, why would I put a lab and imaging discount on there? Because you, again, can negotiate. So if your plan says that your lab work is going to go to deductible or doesn't cover something, or you're in transition and don't have care but you still want your test to be done, you can have access to discounts and pay cash for some of the services. Lab work, just like pharmacy, varies from facilities. If you want the most expensive lab work, so if you're paying a lot towards your deductible, it's going to be in a hospital setting. Where if you go to one of the vendors outside, depending on what it is and your level of what you want from a care standpoint, you can go to a off-site facility or a imaging clinic and the prices are discounted. But other ways to save as we wrap up today's presentation are flexible spending accounts. If you have access through your employer to a flexible spending account and you're not using it, I'll say it nicely, you're crazy. It's pre-tax money. Don't pay tax on money and don't pay your health care expenses with after-tax dollars. I maxed my flexible spending account for years because I know what I'm going to spend on all my testing and my blood work and just for our son's tests and follow-up, and look through everything that you spend on your health care costs. If you have access, now I know not everyone does, but if your husband, spouse, wife has access, or you through an employer, take advantage of it because it's done pre-tax, so you're not paying tax on that. And most of us don't get the qualifications to have our medical expenses as a tax deduction. So that's a real great one that automatically, if you put the maximum of $2,500, you're automatically going to save about $600 in a year. And then if by chance you have one of those high deductible plans, and they have to be qualified, so you just have to double check, you'd be able to do a health savings account, which gives you the ability to give even more money away beyond the $2,500 of a flexible spending account. These are specific to the plan you have and whether you have coverage for yourself or your family. If that's something you want to look into, you can contact us and we can walk you through on whether or not you qualify for that plan. As I mentioned earlier, you can pay cash for care. You're not required in any way to use your insurance. If you think it's a less expensive way, a great example of this is chiropractor. My chiropractor is not in, but I really like her. So I asked her, what would you charge me if I paid you cash? She charges me $40. That was what my copay would have been, but she's happy to take the $40 cash and she doesn't have to submit it. I'm able to see who I want to see. I just negotiated for a cash price. As I mentioned before, ask for samples. You can do this at pharmacy level. You can ask, mostly at the pharmacy is going to be more basic things. If you want specific drug samples, that would be from your physician or specialist. Join discount clubs, like I mentioned, Walgreens, using discount cards like the one that we're providing. Shop online, look at different options. Mail order pharmacy, that 90-day way to save. Compare cost by facility. But the biggest thing I can tell you and teach you from this presentation is to ask questions. Discounts and savings isn't just going to jump in your lap. You have to ask questions. So when you're out there and you print off this presentation or have a copy, take it with you. Have it in your drawer so that when you know that you have to have care, just remind yourself of everything that we went over today. Learn your plan. The biggest challenge I have is when someone says, I don't like my plan, a lot of times it's because they don't understand their plan. So know what your copays are, know what your network options are, know what your care is, what doctor do I want to see, who's the most important to see, do you have a center of excellence. Use all these tools to help manage your care, because of anyone who is frequently going to the healthcare providers and using the system is people with genetic conditions like us. We're the ones that really have to be out there asking the questions. Because if we were healthy and just went for our grand, just once a year preventive checkup, that would be great. But sadly, that's not the road that we walk on. So the road we walk on, we have to be the best consumers that we can be. At the end of the presentation, I've given you links to healthcare.gov, their Facebook page, Twitter page. They also have a YouTube channel and then their blog. This is a way for you to keep most up to date on all of the changes and what's going on with healthcare.gov, the marketplace, Obamacare, the exchange, all the different names that they give it. And then you always have me as a contact. You can contact me through the foundation if you ask specific questions. I have a staff that works for me that is certified and works with individuals and groups to find care through this new day of healthcare that we have. So we're at the end of our hour, and we're going to answer questions. I thank everyone for participating today. And Travis is going to go over the questions that we have.
Well, we don't actually have questions up right now, but I have a question, if that's okay.
Sure, no problem.
Is there so I was pretty amazed at the whole overpaying thing, especially because I just paid a bunch of money for some tests. And none of them were just mine. Some of them were for Shawnee, back when we lived in Chicago. And, like, at one point, I had an issue where the insurance company wasn't, well, I don't know what the word is, reviewing the bill. And so I kept getting bills, and I kept calling the medical provider saying, why isn't insurance covered it? And they said, oh, well, we'll rerun it. And then I got another bill. And I got taken to collections and then out of collections. And this really went on for like 3 years because I'm quite stubborn. And finally, after like the second or third time they took us to collections, and I realized like I could not physically get my insurance to speak to the provider, and at some point it was going to affect my credit. So, like when you have an issue where the insurance company and the medical provider are not speaking to each other, and we qualify this by saying when you call in, you typically speak to different people. So, like,
right.
One of the things I was wondering is, like, is there a way to have one single contact at my insurance company, and then I'll have to follow up?
The two tools that would help you on that is making sure that with your healthcare company that you signed up for their website, and so that you can pull your explanation of benefits in an electronic format, so that you can prove if something was or was not submitted. Because if that provider had submitted it to your insurance company, on the flip side, there should be an explanation of benefits to show and prove that it was processed. In your case, it sounds like somehow there was a coding error or something happened, and that never happened. So if you can show the insurance company, okay, here's all of my explanation of benefits, and this one's not in here, you have to pay it. It helps to give you tools to arm yourself to call and say, okay, I've just gone through all my explanation of benefits, and you did not process this correctly. The second step that you have with any carrier is to appeal it. They all have an appeals department, so you can write a letter of appeal if a claim gets denied, and then it goes to a higher level beyond just your basic customer service. But again, you really are put in that position of fighting for yourself. I just went through it with a client yesterday who a facility made them pay $32,000 out of their pocket to get care because it was out of network. They didn't file the claims right, and now I'm trying to get the money back for the patient, which I'll get. It's just a challenge to go through the process. But the best way on there is first go to your carrier website to prove that it never was submitted. One, you can show it to the provider, okay, you never submitted it, something's coded wrong, because everything is electronic now and everything has a 4-digit code tied to it. So I've actually had men charged to have a baby because it got coded to the male instead of the wife, and that was a nightmare to get fixed. So it's not the system is not a perfect system, and you really do have to pay attention. But the letter of appeal would be your last resort in appealing it, because then it goes to a higher authority. And worst case scenario, if they still don't do it, is to go to file a claim with the insurance department in the state you reside.
Okay. But there's no way to actually, like, why not have
usually carriers won't talk to the providers because everything's done electronically. But if you can prove yourself through the website that they never filed it, that's your best bet. Or if you have an agent.
And all insurance companies have a health advocate that I can call, or a patient advocate that I can call to help me?
Well, if not, you'd have to request one, and the patient advocates are based on conditions, and you can request one. So you have to get it approved. But on a claim side, you can ask for a claim supervisor and explaining that it's affecting my credit, you didn't process this correctly, I want to appeal it, and then go to that supervisor. If they still can't help, then you go to the appeals department because that's even higher than them. So you just have to go through a process, but just make sure you document everything because documentation is key in any of that.
All right, well, it's getting upwards towards 12 my time, 2 Eastern. One other question just came in I want to address before we switch over. It was from Bonnie. She was asking how she can save our slides. This presentation is being recorded, and we're in discussions of when we're going to do another live run of the webinar, where we'll play the webinar through, but then actually have live questions afterwards. And then after we've done that, we'll have this archived on our website. So that'll be, we'll advertise that, let everyone know on all the different Facebook pages and on our, the front page of the website that we have that archived. And if you don't find it, let me know. I'm going to switch real quickly over to a couple of closing words. If you would just give me one moment, please. There we go. Yeah. All right. So a little bit of information. If you can't make it to the live replay, if you can't find it after it's been archived, contact me. My email is real simple: Travis H. Bray at HCC, which stands for Hereditary Colon Cancer, hcctakeguts.org. You'll be able to visit our website. We'll have information on there. You can check us out on the different social media pages as Twitter, Facebook, and YouTube. I want to thank Myriad and Genentech again for sponsoring this. And we do need, we want to have these webinars more often, and we do need patient feedback on, on what we're presenting, how we're presenting it, what the issues are, what you thought of it, how we can do better. So please look for an email with a 5-question survey to arrive in your inbox. And once you fill out that survey, it'll be real quick. It'll really be helpful for us. We're going to shoot you a prescription discount card that has our fancy little logo and the DNA dude on there. And yeah, that's pretty much it. If no one else has any other questions, I just want to thank you all for attending. This was a lot of fun and very informative, and I want to thank Michelle for her time as well.
And thank you for having me, Travis. Everyone have a great day.
All right. You all have a good day.